like later on that evening, that's when I was kind of coming out of the fog. That's when I really realized. And I remember that evening, because Clay had already told me, my husband had already told me, but that's when I started to realize, like, what's going on.
Hi, welcome back to Let Me Ask You Something, a weekly podcast where I, MD Pittman, talk to regular people about something extraordinary that happened in their lives. Now, this week we talked to Kari Shafer, a woman, a friend of mine, who had a brain aneurysm and had an operation at the end of last year that could have turned deadly. Now, this is a trigger for a lot of people because there's a lot of heavy issues that we talk about in this episode, so that is my warning for you. So, without further ado, here's my conversation with Kari. Welcome to the second episode of Let Me Ask You Something, a podcast where we talk to everyday people about something extraordinary that happened in their lives. And today we have a friend of mine, a dear friend of mine, Kari Shafer. Kari, you had a brain aneurysm earlier, or at the end of last year.
Mm-hmm.
And so I'm going to ask you a little bit about that. But first, from what I understand, a brain aneurysm is just a weakness in the blood vessel that kind of acts like a balloon and it pops.
Yep.
And this is a rare condition. From the statistics say that 200,000 people a year, affects more women than men, get this. And that's 0.06% of the population of the United States. So tell me, Kari, well, actually, I got to start doing this. Let me ask you something, Kari. How did you realize you had this? How did this start?
So, actually, I didn't find out that I had it in a typical way that most people would. Most people find out that they have it in a much scarier way than I did. Most people would find out by um, extreme pain or more typical um, passing out, and just symptoms that are like an extreme headache almost. I went in November of 2019. I went into the hospital um, with stroke-like symptoms. They thought I was having a stroke, and uh, turns out I wasn't. I was actually having what's called a complex migraine, which is a totally different thing. But in the process of testing for that, they actually, doing all the different scans in the brain and everything, is when they found the aneurysm. And so they found it, um, again, in one of those scans. At the time, though, it was too small for them to want to operate in November of 2019. And so we didn't operate at that point. They said, we'll check you back in 6 months. Just to see how big it's gotten, or if it's grown at all. Sometimes they grow, sometimes they don't ever get any bigger. When you find them incidentally like that, from what I'm told, a lot of the times they don't get any bigger. And just to kind of go back a little bit, your assessment is basically correct. It's a part of a blood vessel in the brain that is irregular. It can be ballooned up. It just depends on where. It really just depends on what part of the blood vessel in the brain, where it's at. I'll get to where mine was in just a minute. But so we went in. I say we because my husband has been by my side the entire time. But I went in beginning of June of 2020 and had a regular scan, and it showed that a CAT scan showed that it had grown a little bit. It had grown a little bit, and so they wanted to do what's called a cerebral angiogram. And what that is where they basically they go in through the groin area in the artery and go all the way up to the brain. And it's very similar to what a CAT scan does,
Okay.
but it's much more intense picture and it gives a very exact picture. And it instead of like an X-ray style picture, like a CAT scan was, and they go up through the artery because there's an artery that goes from the bottom of your foot that travels all the way up to your brain. So I'm not sure,
Oh, wow.
not a lot of people know that. But anyways, the easiest access is through the groin area. And it's called a cerebral angiogram. And so they did that. And when they did that, they realized that it actually had grown from 2 millimeters up to 4 millimeters in the span of just about 6 months.
Is that a lot? It seems like a lot.
In 6 months, yes. It would normally not 4 millimeters would normally still not be big enough for them to consider operating. But the fact that it grew from 2 to 4 in 6 months, they told me that they wanted me to decide if I should operate or if they wanted me to wait a year.
Okay.
And so
When you hear the word aneurysm,
mhm.
what do you think of? Because I mean that's one of those trigger words I feel that has this horrific connotation.
um so I it's terrifying.
Yeah.
It still is terrifying because you know, when I get into a little bit later and I get into the specifics of it, you know, you'll hear a little bit more about it. But it's you know, I had an uncle that had a series of things that led to a brain aneurysm, and he did not make it. Um, I've known other people that have had one. One of my friends had one, and she did make it, but it's not. It's it's just not. It's terrifying is the best way to describe it.
Yeah.
And so, you know, and I'm 35, and so to think that I'm living or I'm such a young age and I am having this just ticking time bomb,
Yeah.
literal ticking time bomb in my inside.
Yeah. Reading about it, that's what they call it, the ticking time bomb.
Yes.
Wow.
And you know, again, most people don't find out about it. Um Luckily, I am lucky is what I mean to say. Most people don't find out about it ahead of time. And I'm lucky that I did. Um in that aspect.
So you said that they can operate in a year or now. So talk about a little bit about the
Yeah.
operation here.
So they gave me they wanted me to make the choice if I wanted to operate, and the reason being is because again it was I say only 4 millimeters, and normally that's not when they would choose to operate. They would choose to operate at 6 millimeters or bigger, but because it had grown in such
Grown,
a small
yeah.
period of time, so in talking with my husband, we decided, you know what, I am young, I'm fairly healthy, let's go ahead and do it now. And the operation, because of where it was and because of the size, it was not going to. There's two different types of operations. One being an aneurysm coiling, which is where they go in the same way that the angiogram um, that went up through the groin.
Yeah.
Same thing, but inside that tube, they literally put a metal coil, go all the way up to where the aneurysm is. Mine was on the left side. And coil it off and pinch it off to where it pinches off the blood flow to the aneurysm, so it literally can do nothing. It cannot burst anymore. And the other option is the official name is I'm forgetting the official name, but basically where they drill a hole into your head and clip it. It's called clipping. It's called a clipping, where they clip it off by taking a piece of your skull out. That is usually done on a more emergent type basis. But mine was scheduled for the coiling. On September 3rd was the scheduled date of coiling. So September. Did you have more questions first?
No,
or do you want me to talk about that?
Go ahead. Just I'll interrupt when I have a question.
So I'm gonna move you here because I need some water real quick. So September 3rd was the scheduled surgery date, and because it was, I say, just a coiling, it was supposed to be an overnight stay, and I'm gonna go home the next day. In the surgery, in the middle of the surgery, the surgeon hadn't quite reached my brain with the tube was up there, but the coil was not, from the way I'm understanding. And the aneurysm burst in the middle of the surgery.
Is that rare to have that happen?
Yes. In this particular doctor, he's from Australia. That has no bearing on anything.
Yeah.
I don't know why I have mentioned that, but he's been doing it a long time. I think he said 35 years. He's done thousands of surgeries. And this has only happened one other time in this type of surgery that he's done. In this specific, when he's done this specific coiling surgery procedure, one other time has it happened. So no, it is not common. It does not happen.
So on top of having a rare condition, a rare incident during the surgery happened. So this is rare on top of rare.
Yeah. And just as kind of a, to lighten the mood just a touch, my family calls me Side Effect. That's my nickname. And it's because if something can go wrong, it will go wrong. And I literally, in my husband's phone and my best friend, my real life best friend, literally in their phones, I'm listed as Side Effect. So, and it's to do with the past 2 years of my life. But so it burst. I had a bleed. Obviously, my brain was bleeding. They had to. They had to ask. They called my husband from the operating room. Actually, they didn't even go out and talk to him. They just called him from the room because of time. But they asked him for permission to drill. It's so intense. I don't know how else to say it.
Yeah. So
I hope any listeners are not
queasy,
weirded out. But
I can put a note saying this is
it's intense.
For those with
a
weeks.
Intense, but they had to call from the operating room asking for permission to drill into my skull because they were about 60 seconds. They called him And one of the nurses was saying, doctor says he's about 60 seconds from having to drill into her head because of the blood. Do we have permission? And he said, yes, absolutely. They didn't have to, obviously. I got my full head of hair. But they were able to coil off the remaining. I don't fully understand exactly, but the remaining part of it, they were able to coil it off.
Okay.
And
so that was like a plan B. If they had 60 seconds to do this, and if not, they had to drill.
Yeah.
Yeah. Okay. So they had to,
because of how much blood was
coming out.
And they were able to somehow drain it a different way, and I don't fully understand that part, to be perfectly honest.
So take this after the surgery here. When were you told what happened, and what was your reaction? Like, I'd be like, oh my God.
Well, I was told after the surgery, the first thing I kind of remember was, I won't get into that. The first thing I remember talking to my husband, he told me, and I kind of got it, but I wasn't really fully, aware. I knew I was in ICU, but I wasn't really fully aware. That night, when you're in the neuro, this hospital has a special ICU that's specifically for the neuro department, because this hospital is actually one of the best nationwide for neuro, these types of surgeries, which I'm very blessed to be in the area of one. But anyways, they ask you specific questions, and like they'll ask, what's your name, what's your birthday, what year is it? And I'd say, they'd say, what's your name, what year is it? And when they said, what's your birthday? And I would say Thursday. And so I would have these I had problems with words, with putting things together. And when I started realizing that I was having issues with my making connections and not being able to do things properly, like later on that evening, that's when I was kind of coming out of the fog. That's when I really realized. And I remember that evening, because Clay had already told me, my husband had already told me, but that's when I started to realize, like, what's going on, and why am I here? And I remember turning to him after I said Thursday for my birthday, but like I knew what my birthday was, but I knew that Thursday wasn't the right answer. And I remember turning to him and just bawling, what's going on? Why am I not saying the right thing? I remember saying, turning to him and crying and saying, why am I not saying the right thing? What's going on? And that's when, I'm the nurse was with a couple nurses came in, and they were all trying to explain to me again what happened. And, you're going to be in here for a few weeks. And it was I don't know what I'm not allowed to say or what I'm allowed to say on a podcast.
You could say whatever.
It was a holy shit, I'm alive moment.
Yeah.
But it was oh my gosh, am I ever going to be able to communicate the same way again? Am I ever going to be able to go to the bathroom by myself again? Am I ever going to? There were so many different thoughts and emotions.
Yeah. So what was the recovery like, though? So once you were dealing with these emotions of realizing you can't make these connections, you can't put coherent thoughts together, you can't answer simple questions like your birthday. What was that process once that happened to where you got out of the hospital? How long of a struggle was it for this therapy to get you back to some sort of normalcy? especially at the time of a pandemic.
Yeah. Well, thankfully, um, thankfully my husband was still allowed to come see me at that time. It was, September, the beginning of September, so he was still allowed to see me. They were not excluding people from um, the hospital yet, so that really
In your
helped.
state with Missouri, right?
Um,
I know some states had
yeah,
different. Yeah.
yes, we live in Kansas, but the hospital, we live like 2 miles from the hospital itself was in Missouri, but
Okay.
mhm. But yes, some states, yes, at the time they didn't have an issue. That really helped because he helped me. He actually would help and like specifically come in and talk to me and work with me on like having conversations on purpose about specific subjects so that I could focus on um, memory or just cognitive things. And I didn't know this till after the fact, but he went to the nurses and said, I want to help her. How can I help her? And they told him, come in and talk to her and just
Yeah.
keep her active, you
Yeah.
know. Um, so I was there a total of about 2.5 weeks. Um, and within a few days of being in there, my answering, like I could speak clearly. I could answer the questions clearly.
Yeah.
Um, One thing that really took a long time to get back, and I still am not fully capable. I've lost a lot of words. So I have trouble remembering like the word, like what I'm trying, or like I'm having problems right now thinking of
Yeah.
like the thought of like what I'm trying to see. I can't even think of
Yeah.
what the word what I'm trying to say right now.
Yeah. No, but I think I get it. I think you're having you still have some troubles with words and
It's
what and their
and like when
meanings or
like
interpretations
the
of it.
meaning of a word, yes, or if I'm trying to think of a concept or a specific word, or like if I was there for a while, I would be like, I'm going to use this example because my dryer just went off in the bathroom. I'd be like, kids, go put your clothes in
And you
and then
can't come up with that. Yeah.
they're like the dryer, and I'm like,
Yeah.
yes. And so stuff
Yeah.
like that. um and it was, that the severity of that took a long time. That was the biggest thing, was that the cognitive thing was the biggest thing. um uh I dealt with constant everyday head pain
Yeah. And you
for
had like some physical ailments too. I mean, you had to use a walker.
I did, but that's a whole different that's a whole different thing.
Okay.
This is part of why I got called side effect, but um, constant head pain nonstop. Um, and the neurologist was trying to figure out and get me through all of this. And trying different medicines, getting on and off different medicines. And one of the ones they put me on um, caused extreme dizziness. I passed out one time. I went into the hospital. I went in and out of the hospital. I can't even tell you how many times in the last 6, 7 months. But I went into the hospital and I couldn't. The dizziness was so bad I couldn't come out without the walker.
Yeah.
That lasted a good. That was the biggest one because the dizziness, even though we went down a step on that medicine, the dizziness was lasted for 2 months, I think.
Pretty intense.
Mm-hmm.
Yeah.
Um, Another one that she put me on caused my throat to close up.
Oh my
Couldn't
God.
swallow. Um, Another one caused me to break out in hives. It was was a huge mess.
So how are you doing now? You're
Now
how many months removed from this?
it was September 3rd, so
Yeah,
almost 7.
7 months removed. How are you doing now?
Now I'm doing great, and I actually just had a neurologist appointment today. Um, I am with a new neurologist now. The neurologist is my core um, uh, provider or caregiver for this now. The surgeon is just the surgeon for the physical aspect of it. He is the one to make sure that the physical part of my brain is doing what it should. Just to track that real quick, the lining, the coil is in place. The lining of my brain is damaged, and it will be damaged. It's just not going to get better, is what
And
it is.
with the lining of the brain, does that prohibit you from making a full recovery or as full as possible? Or
So it will um, it will probably be um, so I will for a while. Yeah, it could be up to it could be a several years before I will ever be without some type of slight pain.
Mhm.
But it's just for now it's just a dull ache that sometimes if I'm having a good enough time, I don't even worry about. I don't even think about. But so I finally we were so fed up with this other neurologist and all the different bullshit she was putting me on.
Yeah.
We went to a new one. I was living in so much pain daily. Went to a new neurologist about 7 weeks ago. She actually put me into the hospital and basically detoxed me
Okay.
from all the medicine, literally all the other medicine she put me on. This other one put me on.
Yeah.
And I came out 2 days later with almost no pain. I
Really.
had been living for 5.5 months. I had been living since it burst between a 6 and an 8 on a pain
Wow.
scale, and I came out with almost none. And I've had some migraines here and there, which now my migraines present differently than they did before, which is another story. But um,
Are you worried whenever you get some sort of head ache that it
yes,
it
yes, very. But that is an anxiety issue,
I
and
think
that
I
I
think
have
I think
learned
that's
to
normal.
control.
But I think that's just
No, it's
normal.
it is, and I actually talked to the neurologist about it today, and she told me that she said you are 100% justified in feeling that, and I am here to tell you that if you want me to schedule you an MRI or a CAT scan, I absolutely will.
Yeah.
Because this new lady is fantastic, and she's like, I am here for you, whatever you need. But I'm telling you that you are most likely, I feel, perfectly fine. And I said, if you think that, and if my surgeon, Dr. Neal, thought that, then I'm good. So,
Yeah.
but yeah, this new lady has me on a path of that's great. I'm doing wonderfully. I um again, the biggest thing now that I'm dealing with is that my migraines present differently. Now that I've had this,
What do you
they
mean
call it a
present
traumatic.
differently? Is it like different part of your head where they ache or
They feel different than they did before,
okay.
and they come on differently than they did before. So like they start different, like they're triggered differently,
Okay. Okay.
so they don't feel the same, and they're triggered by different things now. And she said that absolutely can happen because of the traumatic this is basically considered a traumatic brain injury.
So
So
where do you go from here? What I mean, obviously you have to still continue your therapy, you can still continue whatever medicines you need to be on or off, still see your neurologist for however long into the future. But where do you go from here? Is it just day by day, or I know it's a little cliche, but it's still true. But
mhm.
is it day by day?
um for me, Emotionally, yes, it's day by day. Physically, I am going to see the surgeon in September for another angiogram. Um, as long as that's clear, I'm pretty sure I get checked every I don't remember how many years he said after that, but I think it's every few years. I also have what's I don't remember the term he used, the official term, but the non-official term is called old lady vessels in my brain.
35-year-old with old lady vessels.
It's fine. I tell you, if it can go wrong, it can go wrong with me. But and so this has a slightly heightened just in the past, like he said, 5 to 10 years, which is not very much in this field, has been shown to have a heightened risk to develop aneurysms. So because of that, he wants to check me a little bit more often than a normal person that has had an aneurysm. So I think it's every 2 years. I will go back and have another angiogram to make sure that there's nothing additional forming.
Now, we've met each other through TikTok,
Mm-hmm.
and that been a source of, I guess, therapy for you during this time?
Yes. Yes. So the first time I got on TikTok was back in June when I went for the angiogram. I had to go get a COVID test for it 3 days before I did it. And they said, "Okay, now go home. You can't leave until the test results come back positive or negative." I'm like, "What the hell am I supposed to do for?" So people had been sending me TikTok, so I got on TikTok and I'm like, all right. And then I haven't stopped since then. I love it. And
I mean, it seems like you have no problem sharing your story on TikTok. I mean, that's
no, and no, I really don't. And that has been it is not for anybody but myself. And
yeah,
I have, if I haven't said that
yeah,
in videos, I have meant to. That is for nobody but myself.
yeah.
That's a completely selfish thing for me to put that out there. Um it is strictly for me um to be able to deal with it. There's those videos like on the a lot of the progress ones.
Yeah.
Except for the ones where I'm dancing with the walker and the cane.
Yeah.
Those two were not this. The rest of them
Yeah.
were ones that I pressed record and tried something.
Yeah.
I had no intention of practicing or seeing if I could do it. Oh, I can? Okay, let me go make a TikTok. No. I said, let me see if I can do this. I press record and I try it and I can. So then I find a sound and I add all that captions and all
But
that later.
I think though, I mean, you say it was a selfish reasons, but I think honestly, it can help others who
Absolutely.
not necessarily going through what you did, but some sort of physical or mental ailment.
Mm-hmm. No, it absolutely can. And I've actually become, close-ish with some other people who have, and I talk daily with a couple people who have, one who has an aneurysm that I don't remember how she found it, but she's got one that she's living with, and I talk daily with her. Um, and then another who has a different ailment, but it's an invisible illness is what we call it. It really can bring people together. And just being able to, Yes, it was a selfish reason, but yes, I agree that it can show people that um, people can do hard things, and it's good to at least try and push yourself. And it's also okay to be vulnerable
Yeah.
and just be you. And um, I'm really, really thankful to be able to have that community that I've built with so many people that I've never met in person. And that's one thing that I'm really, really thankful for um, during the pandemic.
Yeah.
It's brought me close to so many people. So,
Any
including you.
final? Oh, thank you. Any final thoughts or anything you want to tell anybody out there that may be going through this or something similar, or not even similar, but another medical issue, personal issue?
Honestly, the biggest thing I can say is just whether it's, you know, I want to say keep the faith, but that's so silly and cliche. Not silly, but for me, it's not silly, but for keep 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 your head up. It's
Well, I
not
mean,
again. It's
I
not
think
like
the
that's
keep the faith is a little
keep the
cliche, but
faith.
it doesn't make it any less
It's
not true.
no, and but try to stay positive, but cling to the people that that are close to you. And gosh, my husband has been such a strong point in the last year for me, and I don't know what I'd do without him. And even some of the people that I've met on here, like I said, have been such a strong point for me, and I cling to that. So um just cherish those around you, and cling to that. And um, make sure you tell everybody that you love how much you love them every day.
Great. That's a great way to end. So, Kari, thank you very much. You are my second guest on Let Me Ask You Something. So,
Thank
I
you.
appreciate it. Thank you very much.